Good afternoon, everybody. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Welcome to our regular press briefing for today, Monday, May the 11th. This begins the 10th week that we have been living with COVID-19 here in Montgomery County. We're going to divert from our normal order today. I'm going to turn over to Commissioner Ken Lawrence.
All right, good afternoon, everyone. I wanted to let people be aware that I was tested for COVID-19 on May 9th at the Black Doctors Consortium event in Pottstown. And yesterday I received news that my test result came back positive. I am asymptomatic, meaning I'm not experiencing any symptoms, and I've had no known exposure to anyone positive. The reason why I was at the testing event was because this was the first time the Black Doctors Consortium had come to Montgomery County. I had helped bring them here to provide testing in Pottstown. And I was strongly encouraged to get tested by Dr. Stanford because I'm in a public position and because I have a lot of exposure to people. So that's why I got the test. And much to my shock, the test came back positive. So I am self-isolating at home and quarantining for 14 days and will continue to work from here and call in and do what I can. So I would just say that I think this is an example of that we need more community testing, but that also asymptomatic people can be positive and never know. So while I was not planning to get tested, I'm very grateful that I had the opportunity to do so. And I'm thankful to the Black Doctors Consortium that they were able to provide that test. So happy to answer any questions.
Are there any questions for Commissioner Lawrence right now, or we'll have another opportunity later?
So we have one question that was submitted prior to the press conference by Kevin Tierney from Burb Media. The question is, now that Commissioner Lawrence has tested positive, will Commissioners Arkush and Gale be quarantined for 14 days, or will any others be quarantined?
I can certainly take that. So we have now been tested, and we will base our next steps on the results of those tests. We will be working from home for now, and we'll keep you posted as we get additional test results back. Anything else for now?
That appears to be all of the questions so far submitted prior to the press conference.
Okay, great. Well, then I'll proceed with our normal update. So as I mentioned, it is the beginning of our 10th week here in Montgomery County. Since our press release on May the 9th, we have 83 new cases of COVID-19 reported in Montgomery County on Sunday, and 18 new cases today, which brings us to a total of 5,110. 18 of these cases of this group that I just mentioned are from long-term care facilities. These positive individuals are from 26 municipalities, none of which are reporting new cases. So this keeps us to 61 of our 62 municipalities that are home to individuals with COVID-19. These individuals range in age from 10 years old to 95 years old. And as always, you can check our county map at montcopa.org/COVID-19 for updated geographic information. We have 59 females and 52 males in today's group. 3 are known to be hospitalized, 2 are at home in isolation, and the remainder we do not have information on. I'm also saddened to confirm that 3 more Montgomery County residents have lost their lives to COVID-19, which brings us to 417 deaths confirmed positive from COVID-19. One of those individuals died in a hospital, 2 died in a home or facility. They ranged in age from 79 years old to 88 years old. And in total, we have now had 227 females and 190 males lose their lives to COVID-19 who are Montgomery County residents. The racial breakdown, and I remind this is self-reported for those who we were able to obtain it, 12 Asian, 3 Asian Indian, 3 Asian Korean, 40 African American or Black, 110 white, and 249 unknown. Today, we do not have information on probable deaths, so we will try to get that to you for tomorrow. I'm happy to report ongoing improvement in our hospital bed situation. Just as a reminder, on March the 23rd, Montgomery County hospitals reported approximately 15 COVID-19 inpatients, with 4 requiring ventilator support. Today, I'm happy to tell you that we're continuing to see a reduction in hospitalizations. We now have numbers that are in the mid to low 300s. So we've been making progress there. As you know, for the last couple of weeks, we were pretty steadily at 400 people hospitalized, but we now seem to be steadily coming down, which is extremely encouraging. However, it remains that 25% of those individuals do require a ventilator in order to breathe. In terms of long-term care facilities, we have 93 facilities that are reporting positive cases of COVID-19 among their staff or their residents. In total, over these last couple of weeks, we've seen 1,409 cases among residents and 562 among staff. Just a reminder that not all of these individuals are Montgomery County residents, and so the numbers that I just shared with you don't tie up or roll up into the big number that I announced earlier. But we do continue to track these cases separately. We believe it's important that all involved understand the very real challenge that is being faced in many of our long-term care facilities. We continue to do outreach to our hardest hit facilities. By the end of the day today, our FAST teams should have visited about 80 facilities. The purpose of these visits is to offer help and support, check in and answer any questions that they might have, see if they have adequate personal protective equipment and need any help or information about using that properly, and in general, just offer any support that we can. We continue to recommend testing as much as they are able, and help to connect facilities to labs that do have testing available. In terms of our correctional facility, everything is stable today at the Montgomery County Correctional Facility. No new individuals have tested positive from the coronavirus, and the inmates that have tested positive are all currently stable. Our Norristown Walk-Up Community Testing Site was open today and will be open each day this week, weather permitting, from 11 to 1. Appointments will open up for residents of the Norristown municipality tomorrow morning at 8:30 a.m. by calling 610-592-0680. That's 610-592-0680. And we want to thank Delaware Valley Community Health Center for the wonderful partnership that we've established with them to offer this walk-up testing site in Norristown. The drive-up testing site at the Montgomery County Community College is open and running smoothly. Again, thanks to the Community College and Whitpain Township and their police, the National Guard who continues to staff this testing site, and the several county departments that are assisting. From the dates of April 16th to May the 6th, we have now tested 4,140 individuals. We have received results on 97% of those people, 4,005 individuals. 597 of these individuals are positive. So in total, for the first 18 days, we've been running 15% positive But I am happy to tell you, and we don't have the graphic up today, but we are starting to see the daily positivity rates trending in a downward direction. So this is really good news. The appointments for tomorrow, Tuesday, will open at 8 a.m. tomorrow morning. Appointments can be made at montcopa.org/COVID-19 by clicking on the green County Testing Information button, or you can call 610-631-3000, also beginning at 8 a.m. tomorrow morning. I do want to remind everyone that as of today, the Rite Aid drugstore located at 1856 North Broad Street in Lansdale, so that's the Rite Aid on North Broad Street in Lansdale, is available and open for testing. It is no cost. They will only test individuals that are 18 years old or older. And you can go online at riteaid.com/pharmacy/services/COVID-19-testing. I know that's a long one. I'm sure if you just go to the Rite Aid website, you'll be able to find it. And you pick your state and your location, and then it's a pretty simple sign up. So that is now also available here in Montgomery County. I do just want to confirm, because there was some confusion about this last week, that Governor Wolf's stay-at-home order has been extended to June 4th for counties that are in the red phase, which we continue to be in. And I just want to reiterate Commissioner Lawrence's comments that we don't know who's positive and contagious, and how important it is to take personal responsibility for how you interact with your household contacts, with your community, when you run out to the grocery store, and to make sure that you make as few trips as possible to as few locations as possible. And to just assume that you could be that person that's asymptomatic but contagious and potentially able to transmit COVID-19 to someone else. So, please cover your face. Please make sure you're washing your hands. Do everything that you can to stay safe and to stay at home as much as possible. The good news is, because of your many, many sacrifices, our trend lines are all going in the right direction. We want to get these numbers down as quickly as possible so that we can safely start to relax the guidelines that we've been living under, so that some of our businesses can get back to work, which is where everybody wants to be. But we want to make sure that we do that safely and avoid what would be the most unfortunate outcome, which is to have to go backwards, into the red phase. We definitely do not want to have to do that. So we have to continue to be patient. I know there is enormous anger, frustration, anxiety out there, and I truly am sorry about that. But we have to carry on. We have to do this as a community, because one person can can result in the infection of 100 people, 3 to 4 weeks later. Do want to remind all the small businesses that our round 2 of our small business grant will open on Wednesday and be open for several hours to apply for a total funding stream at this round of $5 million. And if you go to the website now, you'll be able to click through, and if you look through all the documents, you'll be able to see all the questions that will be asked, so that you will be prepared to complete your application in hopefully a very quick manner. And with that, I will turn over to Commissioner Gale.
Thank you. Good afternoon, everyone. This is Montgomery County Commissioner Joe Gale. Because of the recent developments, some individuals have asked me if I plan on getting tested for COVID-19. And the answer to that is no, I do not plan on getting tested. Thankfully, I'm young and I feel healthy. And in my opinion, we should leave the testing kits for people that are symptomatic or those who have household contacts that have underlying conditions and individuals that are more likely to end up being hospitalized if they were to contract COVID-19. I will continue to live my life responsibly, whether or not I am tested. Testing will not reopen Montgomery County. Testing will only inflate the number of positive tests. If I get tested today, for example, that result can change tomorrow. And it's my belief that the answer is not mass testing. The answer should be putting more focus on long-term care facilities, and that's something our staff in the Office of Public Health is doing a great job of tackling. We need to flatten the curve. We have flattened the curve here in Montgomery County. We continue to see a decrease in the number of individuals hospitalized due to COVID-19. And we'll never have zero cases. That's reality with this virus. There will never be zero cases, especially not until we have a cure or a vaccine for the disease. So the goal from day number one was to flatten the curve. We're not going to have zero cases. We've gotten to that point. And I'm not buying into the mass testing frenzy. We must reopen Montgomery County, and we must reopen Montgomery County soon. Last week, I expressed my concerns that there are thousands upon thousands of Montgomery County residents who are negatively impacted by the coronavirus, and they should not be impacted to the level they are by this virus. It's harsh for so many individuals, but many individuals that should not be affected are affected. And I'm doing my best to be a voice for those individuals and all Montgomery County residents that contact me expressing their want and desire and their need to reopen Montgomery County. So no, I will not be receiving the test. Our problem is not the number of tests. Our problem is getting into the long-term care facilities as much as possible, helping those senior citizens, helping the employees that work there, all with the outcome of hoping that there's enough hospital beds if individuals do need hospitalization due to COVID-19, and I feel that we're at that point. So I know many are curious, and I wanted to provide that update today. And with that, I'll turn it back to Commissioner Arkush. Thank you.
Okay, we'll open up for questions.
Okay, the first question was submitted by Kevin Tierney from Burb Media. The question is, on May 10th, Bucks County reported 81 positive test results, none of which came through community spread, according to the county. Over the last 2 weeks, how many of Montgomery County's positive test results came from community spread?
Actually, I'm glad you asked that question because I was just going to reiterate that point that while we have had the majority of deaths related to long-term care facilities, about 80% of our deaths, we continue to have more positive cases on a daily basis from the community than we do from the long-term care facilities. So we'll get that graph up again tomorrow. We showed it last week, the graph that had our 7-day running average, or I guess it was 14-day running average trends. And if anyone wants to go back and look on the Facebook page, the graph is there. The blue line are the number of positives from the community. The orange or yellow line was the number of positives from long-term care facilities. So while we do, as I said, I think some people are equating deaths with positive cases. While we do have more deaths from long-term care facilities, we continue to have more positive individuals in the community than in long-term care facilities.
Our next question is from Allison Steele from the Philadelphia Inquirer. Governor Wolf today said that he would withhold state funding from any county that decides to open ahead of his order to ease restrictions. Does today's statement by the governor change anything for Montgomery County?
No, I don't think it changes anything for Montgomery County. We've been working very collaboratively with the Department of Health and with the governor's office. We are in regular communication with them about our situation here in Montgomery County. We have presented some ideas to them. We're waiting for feedback on that, on ways of looking at our numbers in total. Again, remember, and I just want to remind everybody, this isn't just about the one single number, that initial metric that was put out in the governor's plan. This is about looking at possible stress on our hospital systems, on our first responders, on the likelihood of, if we do relax guidelines, do we have the numbers, or do we have the amount of spread low enough that a month from now we won't be overwhelming our hospitals again? So it's much bigger than just a single number. So we're working very collaboratively, and I hope that if people continue to stay at home and they continue to practice responsible social distancing when they're out, that we will get our county open as quickly, and let me not say open, but we will be able to relax guidelines here as quickly as possible. It is an urgent need for all of us. We understand how important it is to help people get their doors open and their businesses back in good shape. But we have to remember that the public is nervous, and rightfully so. And that until we get the numbers of new cases down a little bit lower, it's going to be frightening for people to go out. And, we see that amongst many people. I get a lot of emails from people who are encouraging me to stay the course, that they believe it is the safest way to go.
The next question is again from Allison Steele from the Philadelphia Inquirer. Does Montgomery County currently have any preliminary timeline in mind for when you believe things could reopen?
Well, again, that's going to take a lot of discussion with the Pennsylvania Department of Health and the governor's team, but I would certainly hope within, early June, hopefully. We should, maybe a little sooner, maybe a little later. We're really at that point where this is in the public's hands. I know many of you have you've had it, and you're just going about your business. And I understand that you've had it. I respect those feelings, but the more people that do that, the greater the chances are that we are going to have spread from people who are positive but don't know that they're positive, and that they're contagious and don't know that they're contagious. So it's really in the public's hands at this point. And I will just ask again for every person to be personally responsible in their actions. That is the quickest way to get our numbers down, as they've been trending down. I mean, it's working, but we need those numbers to be a little bit lower. And then we can have very serious discussions about relaxing guidelines.
The next question is again from Allison Steele from the Philadelphia Inquirer. Has Montgomery County had any further discussion about enforcing stay-at-home orders for any business that might choose to reopen in defiance of the order?
We have not had those discussions.
Okay, and one follow-up question again from Allison Steele. Have any businesses been cited for being open? Would they be prosecuted?
I think that's a hypothetical question. At this point, no business that I'm aware of has received any sort of citation. So the answer to that today would be no.
Our next question is for Commissioner Gale from Jim Mellor from KYW. Commissioner Gale, how is general testing connected to or influential of long-term care facilities? Aren't they two different things? How would widespread community testing affect long-term care facilities?
Mr. Mellor, the way you framed that question, I'm in agreement with that. I believe that general public testing should be separated from long-term care facility testing. So I believe the focus should be put on long-term care facilities, do testing there if there's positive individuals, We need to assist them with separating them as best as possible, possibly relocating them to a different facility if needed, but the focus should be on long-term care facilities. I consider one pocket the general public and the other pocket long-term care facilities, which is a contained environment. I hope that clarifies that question.
Okay, if we're just going to hold on for 1 minute here to allow a reporter to submit a question just due to the nature of our format this afternoon. Okay, I've just received confirmation that that is it. We have no further questions.
All right. Well, thank you so much, everybody. And we will see you tomorrow afternoon, most likely at 3. Have a great evening.